Joining us now, Wyoming Senator John Barrasso, to talk with us live about the issue. Senator, thank you for coming in.
Great to be with you. Thank you, Shannon.
Well, let's start with the issue of bipartisanship. We hear the president open that door repeatedly, and yet a number of Republicans on the Hill say it is only slammed shut in their face. Is that accurate?
Oh, I think it is accurate. You know, there are two doctors who are also senators, Tom Coburn and me. I practiced orthopedic surgeon for 25 years in Casper, Wyoming. The president hasn't asked our opinion because he had his 60 votes, so we thought, so he ignored us. And we have a lot of ideas that I think will help bring down the cost of care. In the State of the Union, he said, you know, take another look at my proposal. The American people have looked at that proposal, have rejected it. Fewer than 1 in 3 Americans support it. It's time to start over, take a step-by-step attempt to make sure that we can go and focus on cost of care, quality of care, coverage for more people. But there are a lot of good ideas that the president has rejected up until now.
Well, and we've heard repeatedly that Republicans don't have any ideas, that they're just coming to be obstructionists with the ideas that are in play. And yet, as evidenced by that House discussion or with House GOP that the president kindly attended and had a discussion with them in Baltimore, they do have a number of proposals out there, but they say they just can't get them anywhere.
Well, that's exactly right. The president's proposal calls for cutting Medicare by $500 billion, raising taxes another $500 billion, forcing the states in a huge unfunded mandate upon them. And for people that have insurance, that have what they like, their premiums are going to go up if the president's proposal is passed. And that's why so many people across the country said, get rid of that, take it off the table, let's start anew, let's get real health care reform that brings down the cost of care.
Now, when you hear from folks like the House Speaker Nancy Pelosi, the top Democrat there, say, I'm not really concerned about the process, we just want to get it done. Does that work for you?
Well, she actually said, I think about a week and a half ago, and I don't care what we pass as long as we pass something. And I'm much more focused on making sure we get it right than getting it done fast. It affects every person in America. Healthcare is such a personal thing, Shannon, and it's 1/6 of our economy. The government doesn't do the big things really well. We need to take a step-by-step approach. It's time to start over and focus on getting down the cost of care. That's what so many Americans are concerned about, the cost of their medical care.
And I think we actually have a soundbite from her that we want to play, and we'll get your reaction. This is House Speaker Nancy Pelosi.
We go through the gate's closed, we'll go over the fence is too high, we'll pole vault in. If that doesn't work, we'll parachute in, but we're going to get health care reform passed for the American people.
Do you think the tone has changed at all with the House and its leadership, with the Senate and its leadership in the wake of Scott Brown's election in Massachusetts, and the message that a lot of people think the voters there, at least in part, were trying to send about the issue of health care?
And it's the same message that I hear. I was in Wyoming yesterday. It's what I hear from people all around my state, and senators are hearing when they go home and have town hall meetings. We need to do health care reform. There are ways to do it right. We need to start over in a step-by-step process. Let people buy insurance across state lines. 12 million more would be able to get insurance. Of course, the president, when he was in the Senate, voted against that. Let people who buy their insurance personally get a tax write-off, the same ones that the big companies get. Of course, when the president was in the Senate, he voted against that. Let small businesses group together and be able to bargain more effectively that way. Of course, when the president was in the Senate, he voted against that. So the things that we know work, that are good ideas, that the American people keep talking about, those are the things that the president opposed.
We have just a short time left, but I want to change gears and quickly get your response to this. This week, the SEC indicated that it's going to require companies in their public filings to talk about the impact of climate change on their bottom line. Is that a good use of their time and resources?
It's not a good use of their time and resources. Once again, Shannon, the administration is taking its eye off of the ball. We ought to be talking about the jobs, the economy, and national security. The Securities and Exchange Commission is supposed to protect investors. They're the people that completely missed Bernie Madoff. This was a party line vote. The Democrats said, yeah, companies, tell the American people what effect global warming or climate change may have on your bottom line. I mean, imagine a year ago telling all the companies, explain to us what the impact of, say, a health care bill will have on your bottom line to health care plans. You know, the CIA has now set up a whole section to look at climate change. They've taken their eye off of the security, where they ought to be focusing on national security, and now the Securities and Exchange Commission is taking its eye off the ball and it's looking at climate change. I think they're way off base.
Senator Barrasso, always a treat to have you here. Thank you very much for your time today.
Thanks for having me.